Hello and welcome on in to Talk of the Town here on Channel 57. My name is Rich Reynolds and a lot of ground to cover on the program today, a lot of interesting topics, and in fact we're going to kick it off by talking about April being Oral Cancer Awareness Month. Now by the time you're seeing this, it might be May already, but it's still a good time to check out oral cancer awareness and talk about it as we bring in Dr. Stacy Eby from Eby Family Dental. And welcome on in.
Hi, thank you.
Yeah, thank you. And talk to us a little bit too about why it's so important for people to see the dentist every 6 months. You've been told that ever since you were a kid. See the dentist twice a year. Why is it so important?
Your dental visits help maintain the health of your teeth and gums. If you have a healthy mouth, you should see your dentist every 6 months. However, if you have been diagnosed with gum disease or you have a high cavity rate, your dentist may require that you come in more frequently to maintain your oral health. When cavities are detected early, tooth structure is saved. Your fillings are less sensitive because you don't have to take as much tooth structure away. Sometimes, if you catch the cavity really early, then it's reversible. And if you know where it is and how to care for it, you can actually prevent the cavity from needing to be done altogether.
And always important to try to keep the teeth that we have, right? Don't you want to do that?
It's very important to keep the teeth that you have. Heart disease and diabetes are also linked to periodontal disease. So that's the gum disease. So if you don't get your teeth cleaned regularly, you're more susceptible to gum disease. So making sure that your gums are healthy can alert you of other problems in your body. So when you go to the dentist to get your teeth cleaned in a checkup, there's a few things that they do. They're going to clean your teeth. They're going to take the calculus or the tartar and the plaque and the stain off of your teeth. The second part of it is the checkup, and that's where you have cavity detection, they evaluate the health of your gums, and they do an oral cancer screening.
Yeah, and we'll talk about the oral cancer screening. One thing I found out about going to the dentist, endocarditis linked to oral health, and that's a nasty one. Google it if you want to. We don't have to,
Yes, it is.
we don't have to spend time on that. How about oral cancer screening then?
Well, I don't know if a lot of people realize this, but oral cancer is the 8th most common cancer. And the 5-year survival rate for people who are diagnosed with cancer is around 50%. So early detection is very important. For patients who have been diagnosed early, where the cancer hasn't spread to other parts of the body, the survival rate for those patients are 83%. So that's a huge increase.
Absolutely.
For patients who don't get diagnosed early with the cancer, then that drops to 20%. Sometimes if you catch a lesion and you biopsy it and you can remove the whole lesion before it's cancerous, in the precancerous stage, you can actually prevent the cancer from forming altogether.
Now, what are some of the risk factors? To me, being a former baseball player, all I'm thinking is if you chew tobacco, oral cancer.
Well, I have to say one of the biggest risk factors for cancer is alcohol use and smoking.
Okay.
But there's other things. Men are more likely to have cancer than women, oral cancer. The average age for cancer being diagnosed is 62. So age is a factor. For people who are in the sun a lot, lip balm is important because with sunscreen, very common to have cancer on the lips.
Something I didn't even think about, yeah.
Nutrition. People who are low in fruits and vegetables have a higher cancer risk. Those who have suppressed immune systems also have a high cancer risk. Lichen planus, and this is something I see all the time in my office. It's an autoimmune disorder. So with lichen planus, it can be painless. You can just have some white striations in your mouth, and it increases your risk. About 3% of those patients who have lichen planus will actually develop cancer. So it's very important to have those monitored and checked. But the tobacco use. About 80% of oral cancers use tobacco in some form or another. And 70% of people diagnosed with oral cancer are heavy drinkers. Now you combine the two, the alcohol and the drinking, or the alcohol and the smoking, and you will get people 100% risk increase in oral cancer.
So I guess here the bottom line is get checked. Go to the dentist, see the dentist twice a year. See Dr. Eby, that's a good one too. So Doc, thanks for joining us.
Thank you for having me.
You bet, and we'll have more Talk of the Town right after this. Something we always love on Talk of the Town is talking about good food and then good things to wash it down with. So have some cheese, pair it with some beer. Why not? As we bring in Isaac from Octopi Brewing over in Waunakee. And so thanks for joining us today.
Yeah, thanks for inviting us.
Yeah, tell us, Octopi Brewing, what is it?
We're a country brewery, so we make beer for other people. I had a brewery before in Chicago. I left a few years ago, and then I wanted to open a state-of-the-art country brewing facility for the Midwest. So right now you can start a brewery in 3 different aspects. You can open a brew pub, which is a restaurant that makes beer. You can open your own big commercial facility, or you can contract brew. Basically, you can give us your recipes, or we can make them for you, and we'll make all the process, and you just sell your beer.
Okay, so when it comes to contract brewing, say I was a home brewer, and I decide, listen, I don't have enough money to buy all the equipment that I need to open up a brewery.
Correct.
This is the way to do it then? Is this the way to get into it if you wanted to open
Yeah,
up?
it's an easier way to get into it because we have state-of-the-art equipment, all German, everything automated, and it's way less costly than buying your own place. So with a fraction of the cost, you can start right away. Our minimum quantities are still big, so it's not a hobby. It's like people that really want to get into the business, but it's a perfect way to start.
It's definitely still a hobby for me, and I love it. But I'll brew 5-6 times a year, and you know, it's just to me, it's so much fun to do. But for guys that want to take it seriously, then how do they get started about this whole process? Because I think for a lot of brewers who are home brewers and saying, I would love to do it. This has got to be my full-time job. They don't know how to get started. How do they get started with you?
So first of all, it comes with an idea. Right now, there's about 4,000 breweries in the U.S., so there's a lot of breweries. And the first thing that I'm going to ask you, or anybody who's going to ask you, is why is your beer or your brewery different from everybody else? So you want to have a differentiator that you're completely unique in the realm, and then you also want to have really good recipes that are very drinkable. Nothing very extreme, because people can drink 1 or 2 extreme beers, but you want people to consume, you know, a 6-pack to bring to a party, etc.
Session beers, I think.
Session beer is really big right now, yeah.
Yeah, absolutely. So now, so you do all this contract brewing, but you guys have your own brand? You do your own brewing?
Yeah, correct. We have our own brand. It's called Third Sign Brewery.
Okay.
We sell it in the Madison market and the Milwaukee market right now. Basically, what we do is everything we do in dual pairs. So Third Sign comes from the third sign of the zodiac, which is Gemini. It's all about duality. So what we want to do is grab one style of beers and show you 2 dual interpretations. For example, we have 2 IPAs. One is called Forest IPA, which is piney, resiny, and grassy. And then we have a tropical citrusy, kind of like dry and crisp IPA that's called Jungle.
Huh, okay. Yeah, so within every style, and I think people don't really, realize that, there are different variations in style, right? So
yeah, the range is huge right now.
Yeah, isn't it? Yeah. And you see so many different variations. So so who do you end up brewing for? Are you brewing for Third Sign?
We brew for Third Sign, that's our own brand. And then the other one we can talk about is One Barrel Brewing. So we do all the beer for One Barrel. They started a small place in Atwood on the east side, and right now they're just expanding and they're doing fantastic.
Yeah, so it's kind of hard to brew it just 1 barrel at a time.
Correct.
If you want to really have a lot for people to drink.
Yeah, we do 100 barrels at a time for them.
Oh, okay. All right, so it's not just 1 barrel anymore, but it's 1 big barrel maybe.
One big barrel, yeah, there you go.
So good for them. What are some of the styles that you end up brewing there? Is it, because I've seen some breweries, all they do are ales, some breweries, all they do are lagers, some do both. What do you guys end up doing?
So right now we do everything. So whatever the client asks, we do it. We've done from double box that have been in the tanks for 8 weeks, a traditional lager, very hard to make, all the way to experimental beers with passion fruit or soursop, which is another fruit from Latin America that we just put in one of our beers.
Okay. Now, in the Madison area, you guys on tap anywhere?
Yeah, we're on tap in a few places in the city. Okay. Off the bat, people come and go, but we're at Alchemy on the east side. It's a great place for us.
Yeah.
Dexter's Pub usually puts us around there.
Okay.
But
nice.
yeah, you can usually call your bar before and usually have us on type. There's also an app called Bar Menus that you can look up and then just put the name of Third Sign. It'll tell you all the places that have our beer on tap.
Okay, people love brewery tours. I know I'm a brewery tour guy, and you guys do the tour thing?
We do some guided tours on the weekends, on Saturdays.
Okay. How about a tasting room? Do you guys have one of those?
Yeah, we have a big tasting room for about 100 people. We serve some pizza, some craft nuts, some pretzels, but we also have 14 draft lines, mostly of our own beer, different varieties. So there's always something for somebody.
Wow, seems like so much is going on. The only other question that I would have is why octopi? Where did you come up with this name?
Sure. It was my wife and I would just like the symbolism of the animal. So octopus has 8 tentacles. We can do 8 things at a different time. It's a grounded animal, so we're grounded in our approach. It's invertebrate, so we can switch shapes really, really fast. And it's underwater, so we're in constant motion with the beer world.
Yeah, that's a great name to come up with.
I
then.
appreciate it.
Absolutely love it. Check them out. Octopi Brewing in Wanakee. We'll be back with more Talk of the Town right after this.
Thank you.
Back on Talk of the Town, and always good to have a familiar face here as we have Greg Guion, who's back from Medical Art Prosthetics. And Greg, welcome on back.
Well, thank you.
Yeah,
Good to be
always-
back.
Yeah, always love having you on because it's always such interesting stuff. The pictures always tell 1,000 words as well. And we're going to talk a little bit about the specialty of facial and somatic prosthetics. So, what are somatic prosthetics?
Right. We've talked about facial prosthetics, and just to bring the two together, I'm going to show you some quick examples of facial prosthetics. Are, as we've shown before, nasal, orbital, and auricular prosthetics. So this would be an example of a nasal prosthesis. This would be an example of an ear prosthesis. These things, you know, go on the patient, come off. They're not permanent. And then the orbital prosthesis would be an artificial eye with the surrounding tissue. Somatic prosthetics, which we'll talk about today a little bit, are those parts of the body that can be restored with prosthetics, including the hands, feet. Sometimes breasts are included in somatic prosthetics. It's kind of a general, all-body, all-inclusive for all those parts of the body that need to be restored.
Okay, so we're talking extremities then, I guess.
Yeah, I
Right,
think for my specialty, silicone somatic prosthetics, we're talking about hands and feet.
Okay.
And I think the important thing to remember is that these are the visible parts of the body that people see in the public. So when they're to be restored, sure, we want them to be functional, but the real priority is that they look natural. So I think what we'll do is look at some photographs
Yeah, let's take
rather
a look,
quickly.
absolutely.
So yeah, I'll blast through these really quickly so that we can get an idea what these are. So example number 1 here is a amputation of part of the hand. So we call this a partial hand prosthesis. So this is a silicone restoration. The person would slip on. She could go about her
wow.
business and blend
So
in.
it looks like it almost goes all the way up to the wrist then? Is
It
that-
does,
okay.
exactly. This is an example of just an individual finger prosthesis. And I think in this case, I just added a before and after. So this is the prosthesis itself. And there she is wearing a prosthesis in place. So the idea is that if you're not looking for these on a person, you're not going to notice it.
Right. Well,
Thumb-
they end up looking so natural. I guess so much of it too
There's
is
a
how
thumb
much
prosthesis.
you have to focus on the color of it and getting
Exactly.
the skin tone right and texture. Yeah.
And so we even get into the full hand prosthesis where there's been an amputation at the wrist.
Okay.
And this is a much larger thing, but I actually work at the university where we can scan and mill a 3D, a mirror image, so we can use the hand, the unaffected hand as a model, mirror image it, and then create a prosthesis that's almost a perfect mirror image.
Amazing.
Right down to the skin folds, wrinkles. So the idea is the person can wear their prosthesis out and look normal. And then this is an example of obviously a foot amputation or toe amputation where, same thing, we end up making a silicone prosthesis that just looks really natural.
Wow.
Yeah.
And I would imagine, I mean, that could be from so many things. You might work with patients that are diabetic, maybe?
Exactly.
and have-
Yep.
with stuff like that.
Circulation problems or
Okay.
traumatic amputation.
Can you explain a little bit, I guess, the basic process of how these devices are actually like fabricated? How do you do that?
Right. Well, the process starts off with an evaluation. We often then take impressions of the affected part, and then also impressions of the unaffected hand or foot. And we use the unaffected side as a model for the prosthesis. And then we go through a series of check sockets, in other words, basically pieces of silicone that go on the residuum, the affected part, to make sure the fit is good. And then we work into the actual sculpting and shaping of the prosthesis so that it looks natural and add detail. Ultimately, we make a mold, and then we fabricate the part in silicone. The patient comes back, and then we do our final finishing, tinting, sealing, and delivery. So it's a rather straightforward process.
Yeah, I think that too. There's a lot of benefits for these patients now. What are some of the benefits for them actually getting the prosthetics done?
Well, the obvious benefit again is so that they can put their prosthesis on, go about their business, and not have their difference become the topic of every conversation, having to explain how they lost this body part, how they're going to be treated. They can blend in, so to speak, and feel comfortable. And this actually does become an important thing in people's vocations. You know, if you're an actor and you have a part of your hand amputated, wearing a prosthesis allows you to become an actor and not have that become the focal point. A lot of examples like that.
Greg, always interesting. The stuff is always amazing. And as always, we have too little time to even talk about
Yeah, that
more.
went fast.
We appreciate you coming in.
Yeah,
thank you
thank
so
you.
much. Yeah,
Thank
we got
you.
more Talk of the Town right after this here on Channel 57. We started off the program actually with a dentist and talking about our teeth a little bit. Now we got something to say cheese about. We're missing the photographer, I guess, along the way, but we do have cameras here. Welcome back. Talk of the Town. Peg and Steve Schuett are here from Cheezers in Stoughton, and welcome in. Thank you so much for joining us. Yeah, tell us about Cheezers, the history, how long you've been in Stoughton.
Cheezers has been in Stoughton for about 21 years.
Wow.
It's an anchor store in Stoughton. We have a lot of cheese and other things. It really is a neat store in that it has unique items. You don't just find that in any store. People walk in the store and say, "Oh, this is so nice," and the ambiance is warm and friendly, and it's just a really neat store.
Yeah, absolutely
Even though
love
it's
stores
mine.
like that. Yeah, when you walk in and it's something different and inviting and nice, and you know, being in Stoughton too. I mean, what a wonderful place, you know, to do that. So, do people have to go to Cheezers and right into the store to get your product, or do you actually send them out? It looks like a box like that you could be able to ship, huh?
Yes, we do. We ship gift boxes. We ship just cheese. People order from all over the country.
Oh, really?
We
Okay.
have our website, cheezers.com.
Okay. What's one of the farthest places you've sent off a box?
South Pole.
South Pole?
Yep.
Really?
We don't actually send.
It's been taken to the South Pole. We ship within the continental United States. We ship a lot to Alaska. We ship a lot to California, out to the East Coast, Texas, Arizona, Florida. Those are all areas that really crave Wisconsin cheeses. And we have a lot of people who are from Wisconsin that go down to Florida and down south, and they miss that cheese, so they
Absolutely.
order a lot.
Yeah, we had moved down for a while to Texas and Arizona, and that's one thing we definitely miss was the cheese. Absolutely. So you said that you're in Stoughton. I'm sure then, like, part of the events that are coming up, what are some of the big events coming up in Stoughton? I'm guessing there's a big one right around the corner.
yes. Sitten de Mai
Yep.
is coming up. It's the 13th, 14th, and 15th of May. Sitten de Mai means the 17th of May.
Okay.
And that was Norway's Independence Day. So we have a huge celebration. We have 2 parades. We have style shows with the Norwegian attire. We have Norwegian cheese tasting at the store.
Oh, terrific. Okay.
And
What
we
are
also-
some like Norwegian cheeses then? So I see a sampling of cheeses here, but what are specific Norwegian cheeses?
We have Jarlsberg. We just got our Nakkelost.
Okay.
And that's a very hard to find cheese.
Hard to say, too.
Let's see, Gjetost. We have Ekta Gjetost. We have Snowfrisk. We have quite an assortment of Norwegian
Jarlsberg.
cheeses.
Yeah, you're going to have to try some of
Jarlsberg.
that.
And did I say Jarlsberg?
Yeah, wow.
And we also have fresh lefse every week.
Oh, terrific. Yeah, I was just talking to someone about lefse this morning, so all kind of ties together. So what other products do you have in the store then when people come
On
in
Set
and
to
get
My
this?
Weekend, we also do a special with the lefse and mascarpone cheese and lingonberries. We make a lefse roll-up, and it tastes like a piece of pie, and we probably make close to 1,000 of those that weekend and sell them.
Oh, wow.
But people can buy our products and actually make it at home as well. But it's quite a treat that Peg came up with, and it's quite popular.
It's
Do you
fun.
have Norwegian backgrounds? Is that,
I do.
oh, fits right in then. Yeah, perfect. So,
My mom was 100% Norwegian.
oh, okay. So that it's in your blood. That's how it works. Tell us about some of the cheese trays that you make. Here's an example of one here. But you were
Yes.
telling me before we got on the air about some of the other stuff you do.
Yes, well, each cheese tray is individually made. They're very unique. We make them according to events. If someone calls and says they're having a card party, well, we might put some little cards on there, and all the cheeses are labeled so people know what they're eating.
Yeah, I love that. And I don't know if you could see it, but there are little labels here as you go along. So if you want to pick one out that you like, if there's some that maybe you don't like so much, you know exactly what it is. So
We've
yeah,
had
that's nice.
people come in the store and they have been at a party or something and tasted some of the cheese. And because it's labeled, they come in the store and then want some of that cheese.
Yeah,
because
you've
they
given
like
us some very good reasons to visit Cheezers. What's the best reason, though?
I'd say just the warmth of the business itself. You're going to get some wonderful cheese.
Peg, when she started the store, had her way of running a store, and one of them was the cleanliness of the store. I mean, that's top notch in her criteria. But the second thing is that she has brought in a lot of high school age students and taught them how to treat the public when they come into the store, and it's been real interesting to see these people mature as they work there, and how to talk to customers, how to treat customers with respect, and how to meet their needs. And that's one thing you're really going to find at this store is the quality of the customer service.
Excellent. Check them out. Cheezers in Stoughton. Peg and Steve, thank you so much for joining us. And thanks
you.
for joining us on Talk of the Town. We'll see you next time.
Thank you.